Welcome to our module and growth modification in orthodontics. In this video, we'll explore the concept of growth modification and its application in a skeletal Class II deficiency. Let's begin by understanding the definition of growth modification. Growth modification involves manipulating natural growth processes for a clinical treatment. One of the key theories in growth modification is functional matrix theory, proposed by Moss. According to Moss theory, the growth of the cranium and face occurs as a response to functional needs and is mediated by the soft tissue adjacent to skeletal units. Basically, function determines, controls, and regulates form and structure. With this knowledge, we can change the function of jaw to regulate it to our own advantages. Getting the timing right is crucial when it comes to growth modification. If you wait too long to start, it might not have any effect at all. But if you start too early, the treatment will take longer time than necessary. So finding the perfect timing is important to make sure the treatment works effectively and doesn't drag longer than it should. Timing plays a crucial role in growth modification, especially when it comes to different facial planes. In the transverse plane, the growth of maxilla is the first to stop, and this occurs before adolescence. When it comes to the anterior-posterior growth in craniofacial complex in Class III and Class II malocclusion, it typically occurs during delayed adolescence, the mid-teen years. This is the time when significant changes can be observed. On the other hand, vertical growth, which refers to lengthening of the face, is the last to cease. It continues until the third decade of life, which is a later stage of development. Understanding these different timings and growth modification is essential for effective treatment planning and achieving optimal results and enhancing facial aesthetics and correcting any related issues. Class I is the most common maxillary mesiofacial cusp, located in the mesiofacial development group of the first mandibular. Class II is posterior positioning of mandible to maxilla, and Class III is interior positioning of mandible to maxilla. In this module, we'll focus specifically on a skeletal Class II growth modification. Skeletal Class II discrepancies typically involve either excessive of maxillary growth or mandibular deficiency, or both. The goal of growth modification in Class II patients is either to enhance and stimulate mandibular growth, restrain maxillary growth, or both. In Class II, patients with mandibular deficiency, we aim to enhance the growth of the mandible. We use functional appliances to alter the posture of the mandible, leading to various changes in skeletal and dental structures by manipulating the position of the mandible. Holding it open and forward pressure is generated by the surrounding muscles and soft tissues. This pressure is then transmitted to the skeletal structures and dental arches. Through this mechanism, functional appliances have the potential to modify the skeletal relationship, stimulating and enhancing mandibular growth. Functional appliances used in orthodontics treatment can be classified into two types: removable and fixed. Removable functional appliances include the bionator, twin blocks, and Frankel appliance, which can be easily taken out by the patient. Fixed functional appliances such as the Mara, Herbst, and fixed twin block are attached to teeth and cannot be removed by the patient. The Bionator is a removable appliance that features an acrylic occlusion stop to control tooth eruption and a lower incisor cap to prevent facial tipping. By advancing the patient's mandible, the Bionator utilizes the pressure created by the muscles and soft tissues to modify growth. The Twin Block is another removable appliance and consists of individual maxillary and mandibular plates with ramps that guide the mandible forward. It can be attached to headgears and include a screw for jaw expansion. The Twin Block can be either removable with clasps or not removable and cemented. The Frankel appliance is also a removable functional appliance that is tissue-borne. It consists of a large buccal shield and lip pad which reduce cheek and lip pressure under dentition. The Frankel appliance vacillates maxillary arch expansion and mandibular growth modification. Now let's talk about fixed functional appliances. The Herbst appliance is a fixed appliance that does not require compliance to wear it. However, patients need to comply with instructions to avoid breaking it. It consists of crowns on the upper first molars and lower molars and is most effective in the late mixed dentition stage. The Mara appliance is another fixed functional appliance. It is less bulky compared to other options and is often preferred by patients. Growth modification in the axis of maxillary growth involves techniques to guide and restrict its development and growth while also allowing the mandible to catch up. One method is using the application of headgear and orthodontic appliances. Headgear exerts force and maxilla, restricting its growth and allows the mandible to continue growing by using external straps and pads connected to braces or other appliances. Headgear guides the growth of jaws, promoting proper alignment and facial harmony. Headgears need to be worn for at least 10 to 12 hours per day with a force range of 350 to 450 grams per side. In the picture, we can observe a black line representing the position of line maxilla before treatment and a red line indicating its position after 2 years of treatment. By superimposing the before and after images, we can clearly see the effects of using headgear in growth modification. The headgear has successfully restricted the growth of maxilla as there is no significant change in its position after 2 years. However, what's remarkable is the growth we observe in the mandible. The mandible has caught up to maxilla, showing noticeable advancement during the same time frame. This highlights the effectiveness of the treatment in achieving balance between the upper and lower jaws, resulting in improved facial harmony and proper alignment. Choosing the right headgear depends on several factors. Firstly, the signs of vertically excessive growth will determine the direction of the pull. Secondly, the desired type of teeth movement, whether bodily or tipping, will also influence the choice. Different types of headgear can have specific effects on maxillary molars movement. High pull headgear is designed to create distalization, moving the molars backward and intrusion, reducing the vertical height of the molars. Combined headgear is primarily used for distalization, aiming to move the maxillary molars towards the posterior region. Cervical pull headgear exerts force that results in destabilization as well as intrusion, bringing the molars downward. These various headgear types offer orthodontic professionals the ability to target specific movements of the auxiliary molars based on the desired treatment objectives. Let's make a recap of the key points we've covered in this module and growth modification in orthodontics. In this module, we explored the concept of growth modification. In orthodontics, we learned that growth modification involves manipulating natural growth processes. For clinical treatment and is based on functional matrix theory, where function determines, controls, and regulates. We focus specifically on skeletal Class II growth modification, which aims to either enhance mandibular growth or restrain maxillary growth, or both. Functional appliances, both removable and fixed, play a significant role in growth modification. They can stimulate mandibular growth and modify skeletal relationships. Headgear is another tool used in growth modification, primarily to restrict the auxiliary growth and allowed a mandible to catch up. Thank you for joining us in this module in growth modification in orthodontics. We hope you've gained valuable insights into this field. If you have any further questions or would like to explore this topic in more detail, please feel free to reach out to us. Keep us smiling, and we'll see you in the next module.